In addition to working through RP and Q times 2 stat, when we're breaking down and measuring rhythms, there are a couple questions that we can ask ourselves when we're looking at rhythms to diagnose or call, not diagnose because nurses do not diagnose, but in order to identify rather the rhythm that you see. So you should always ask yourself, what is the story that this rhythm strip's trying to tell? Remember, this is the reason why we spent so much time on the cardiac cycle, because we really wanted to drive home the point that each one of these waveforms and intervals is telling a story. It's our job to figure out what that story is, okay? So some questions that we can ask ourselves when we first look at our rhythm strip. Number one, are there P waves? Okay, what do you think? In this example, are there P waves? Yes. I see 1, 2, 3, 4, 5, 6 of them, okay? The next question we can ask, do all the P waves look the same? Yes, in this example, there are P waves and they all are upright and they look similar to one another. This tells us that they should be coming from the same place in the atria. Is there one P wave for every QRS? The answer is yes. There are 6 P waves and there are 6 QRS complexes. What's the relationship between these P waves and the QRS complex? When I ask this question, what we're referring to is what is the PR interval, okay? The PR interval is constant for each one of these P waves and their respective QRS complexes, okay? So the PR interval is constant. So based on So now that we've covered an overview of the sinus family of rhythms, we can go ahead and take a look at our first actual cardiac rhythm here. So normal sinus rhythm. All right. What is normal sinus rhythm? Sinus rhythm describes a cardiac impulse, again, that begins in the SA node and follows the natural path of progression down to the Purkinje fibers in the ventricles. The term normal is indicating that the impulse is occurring at a rate of 60 to 100 beats per minute. The reason for this is because this is the natural inherent rate of discharge at the SA node. Remember, we talked about that before. So, in order to understand deviations from normal, however, we first have to understand what normal is, or what it should be anyway. Now, in the next few images here, you're going to see rhythm cheat sheets as well as sample rhythm interpretations that we'll go ahead and work through together. All right. So first up here on the right, we've got a rhythm cheat sheet for normal sinus rhythm. Notice that the heart rate is in between 60 and 100 beats per minute, which is the normal inherent rate of discharge for the SA node. When we look at the regularity, it is regular. All of these P waves are marching out on time every time, as are the QRS complexes. Okay, so it's a regular rhythm. The P waves are all upright and they also appear similar to one another. In addition, there's one P wave for each QRS complex. What this tells us is that for every beat that's initiated at the SA node, the ventricles picks this up in a one-to-one fashion. Okay, the PR interval is normal between 0.12 and 0.2 seconds, and it's constant. So this tells us that each beat is taking the same exact time to reach the ventricles. And finally, the QRS complex is less than or equal to 0.12 seconds, which is the normal range for the QRS. Remember, every time we see a narrow QRS, that tells us that the impulse is originating from above the ventricles. Okay, remember we talked about how the ventricular muscle is relatively thick and very slow to transmit and impulses and contract. When that impulse arrives, remember, on the fast track from the SA node or the atria above, we should always expect to see a nice tight QRS complex. Now, the only exception to this would be in the case of a bundle branch block, which we're not really going to get into in this video, but a little bit later on we might. So here on the next slide, we've got a sample rhythm interpretation that we'll follow along with using the concepts that we've discussed up to this point. Okay, so here we're working through our progression. This is the reason why we kind of laid that foundation earlier, right? Remember, RP and Q times 2 stat. That describes the process that we're going to work through for every rhythm that we break down together. So RP and Q times 2, rate rhythm regularity, P waves, PR interval, QRS complex, QT interval, ST segment, and T waves. Okay, so let's work through this together pretty quickly here. So what's the rate? We're going to do this for both atrial and ventricular. The atrial rate is signified by our P waves. Okay, on our 6-second rhythm strip here, we have, well, before we get any further, let's describe the 6-second rhythm strip. We've talked about this before, but let's go ahead and revisit it. So luckily for us, we see our hash marks that are measuring out 3-second intervals here. The other way that we could verify this if we didn't have our hash marks here is to do what? Well, we could also count off 30 of our big boxes. Remember, each big box on the EKG paper or ECG paper is equal to 0.2 seconds. Okay? 0.2 seconds times 30 gives us 60 seconds. So 1, 2, 3, 4, 5, 6. We count all the way to 15, which is halfway, and another 15. So now that we know that we're dealing with a 6-second rhythm strip, calculating the rate becomes a little bit easier. So our atrial rate signified by the P waves, we have 1, 2, 3, 4, 5, 6, 7 P waves. Okay, so we have an atrial rate of 70. For the ventricular rate, this is going to be signified by the QRS complexes. I see 1, 2, 3, 4, 5, 6, 7 QRS complexes. The ventricular rate is 70. Now, for the regularity or irregularity of the rhythm itself, again, we're going to do this separately for both atrial and ventricular. All right. Is the atrial rhythm regular or is it irregular? All right. Do these P waves march out on time every time? If we had a set of calipers, we'd go ahead and measure the distance between these first two P waves and then transfer the calipers to the next two in line, and so on and so forth. But just looking at it, we can say that we have a regular atrial rate. So they're coming on time every time, those P waves are. Rhythm regularity for the ventricles is also regular. Notice how those R waves are marching out nice and routinely on time every time. Okay, P waves, they're present and they're all upright as they should be. Our PR interval, if we go ahead and measure the PR interval from the beginning of the P wave to the beginning of the QRS complex, I see 4 small boxes in there. Remember, each small box is equal to 0.04 seconds. So we have a PR interval of 0.16 seconds. That's within the normal range of 0.12 to 0.2, right? Next up is the QRS complex, okay? The QRS complex is a little bit greater than 1 small box, but it's a little bit less than 2 small boxes here. So the QRS complex is going to measure 0.06 seconds. Again, that's less than 0.12, which is the normal expected rate for the QRS complex. So the QRS complex width is said to be normal. It's narrow. The QT interval, remember, this is measured from the beginning of the QRS complex to the end of the T wave. The QT interval is measuring the time that it's taking for the ventricles to fully contract and depolarize and relax and repolarize at the end of the T wave. Remember, less than 0.44 as an absolute is what we use. Sometimes this may be less than 0.46 in women, or sometimes less than half of the R to R interval. But for this example strip here, we have 0.40 seconds, which is less than 0.44, so we're okay there. The ST segments, remember, relative to the isoelectric PR interval. These ST segments are nice and tight in line. The ST segment is measured typically from the J point, or 1 small box after the J point, to the beginning of the T wave. Okay? All of our ST segments are nice and in line with our PR segment, so it's said to be okay. I don't see any elevation or depression. And finally, all of our T waves are nice and upright as they should be. So our final interpretation for this rhythm strip is a normal sinus rhythm. On questions 1 through 4, which we've just asked, here's what we can tell about this strip. There are P waves present, they're all upright, and they look the same. That tells us they're coming from the same spot. The PR interval is constant for each P wave to the QRS complex that follows. That tells us that it's taking the same amount of time for that impulse to reach the ventricles from the atria. Okay? Now, the last question we can ask ourselves is the QRS complex narrow or is it wide? Okay? In this example, we have a narrow QRS complex. Okay? So that tells us, again, that the impulse must be originating from above the ventricles. Anytime you have a narrow QRS complex, the impulse is originating above the ventricles. Okay? So, what's the interpretation for this rhythm strip? Okay? This is sinus rhythm, okay, at a rate of 60, normal sinus rhythm. But what do you notice about these ST segments? Our QRS complex is here. Remember, the J point is the point at which the QRS complex begins to turn and head back to baseline. And then you see the big hump, which is representing our T wave. But this is where the ST segment falls. Notice how this ST segment is much higher than that PR segment that we're using as the isoelectric baseline. So, in this example, you would say we are looking at a normal sinus rhythm with ST elevation. Okay? This would be something that you would see in somebody that's having what we refer to as a STEMI. We talked about that a little bit before, an ST elevation myocardial infarction. Myocardial infarction. This is an absolute medical emergency. If you see this, assess your patient, report it right away. Okay. Next up, let's go ahead and work through this rhythm strip together here. Okay. Are there P waves? Yes. We have P waves here. Okay. Do they all look the same? Yes, they do. So they're coming from the same place in the atria. Okay. They're marching out on time every time, and there's one P wave for every QRS complex. Okay. P wave here, QRS. P wave, QRS. P wave, QRS. The PR interval is constant, so that tells us the relationship is that it's taking the same time for that atrial impulse to reach the ventricles, and the QRS is narrow, which confirms that it's coming from above the ventricles. Okay, so 6-second rhythm strip. Let's go ahead and work through RP and Q times 2. Right? So we have an atrial rate of what? How many P waves are there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay? 11 times 10 gives us an atrial rate of 110. QRS complexes. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 times 10 is a ventricular rate of 110 as well. So we have a heart rate of 110. We have a regular rhythm because everything's marching out on time every time. Okay? There's one P wave for each QRS complex. All right? Which tells us that it's all of our P waves are upright and look the same. That tells us the impulse is coming from the atria. We assume it to be sinus at a 1-to-1 ratio. Okay? So, what we're looking at here would be an example of sinus tachycardia. Okay? Next strip. Are there P waves? Yes. Do they all look the same? Yes. Is there one P wave for each QRS complex? Yes, there is. Okay. The PR interval is constant as well. Okay, so it's taking the same amount of time to reach the ventricles. And again, we said P waves are all upright and they appear similar. All right, so we assume them to be sinus. All right, that's the trick here. QRS is narrow, which confirms what? That the impulse is coming from above the ventricles. Okay. Is the rhythm regular or is it irregular? It's irregular, right? These QRS complexes, notice these big tall R waves are not marching out routinely as we would expect them to. The distance between them is differing. Okay? So, this will be an example of what rhythm? Okay? Sinus arrhythmia. Good. All right? It's sinus because we have upright P waves that are coming at a rate of 60 to 100 beats per minute. They all look the same. The QRS complex is narrow. and it's an irregular rhythm. Remember, sinus arrhythmia is the only irregular sinus rhythm. Okay. All right. Last strip that we have here. I see P waves present. Okay. They're all upright. They all look the same, so we assume them to be sinus. There's one P wave for each QRS complex. The PR interval is constant, meaning that it's taking the same time for every sinus beat to reach the ventricles, and the QRS is narrow, which tells us or confirms that the impulse is originating above the ventricles. Okay, so we'll go ahead and work through RP and Q times 2 stat. Okay, what's the rate? I see an atrial and ventricular rate of 1, 2, 3, 4 times 10. So you have a heart rate of 40 beats per minute. 40 beats per minute atrial, 40 beats per minute ventricular. All right. Is the rhythm regular or irregular? Well, all of my P waves appear to be marching out on time every time, so we have a regular atrial rhythm. Is the ventricular rhythm regular or irregular? So all of our QRS complexes are marching out on time every time with the same distance between them, so we have a regular ventricular rhythm. We can go ahead and take a look at the PR interval here. Okay, so the PR interval is roughly one big box, so it's we'll say 0.2 seconds. Okay, P waves are all upright. What else can we talk about with this rhythm? RP and Q times 2 stat. We talked about R and R, P and P. QRS complex, is it narrow or wide? It's narrow. Okay. If we look here, it looks like there's 1, 2, 3, 4 small boxes spanning the width of this QRS complex, which would be a measurement of 0.12 seconds. Okay, so that's within normal limits. The QT interval is spanning from this solid line to about this solid line, or maybe one small box afterwards. So it appears a little bit longer than it should be, but it's roughly half of the R to R interval, so we're okay there. Okay. What about the ST segments? Here's your ST segment here. Does it appear in line with that PR segment? Is it above the PR segment or below the PR segment? Okay, it's nice and in line. So the ST segment is okay. There's no elevation or depression. Finally, all of my T waves are nice and upright. Okay, so what do we call this rhythm? We have a regular atrial and ventricular rhythm, P waves that are upright, coming on time every time at a rate of 40 beats per minute. This is an example of sinus bradycardia. Okay, good. So that wraps up the sinus family of rhythms. Next up, we'll start to look at, dive into the atrial family of rhythms and arrhythmias, and introduce, well,